Did you know that even the early stages of liver disease can irreversibly damage your internal organs, including your heart, kidneys, brain, and nervous system? The most alarming aspect of this condition is that you might have something like fatty liver disease without even knowing it. Why? Because liver diseases typically don't cause pain. This was confirmed by scientists in a 2022 study titled "Even Early Forms of Liver Disease Affect Heart Health," which found that nearly 86% of patients with liver fibrosis also showed heart abnormalities. In this episode, I'll explore the warning signs our body gives when the liver is in distress. I'll also cover the hidden factors that contribute to liver damage, how to improve liver health, and which tests are essential for an accurate diagnosis. Now let's dive in. What symptoms should we watch for when the liver is signaling for help? Firstly, when the liver is diseased or fatty, you might notice spider angiomas on your skin. These are vascular changes that resemble a spider in appearance. Secondly, you might see redness on your palms and soles, known as palmar erythema. It's important to note that if this redness appears on both your palms and soles simultaneously, it could indicate liver problems. Another characteristic sign of liver issues manifesting on the skin is jaundice. When the liver isn't functioning properly, bilirubin, a yellow pigment, isn't processed correctly and accumulates in the skin, giving it a yellow hue. Finally, liver problems can also cause skin itching or a sensation of pins and needles, especially around the fingers. However, it's important to remain vigilant, as a vitamin B12 deficiency can also cause a pins and needles sensation. Furthermore, liver problems often lead to changes in the appearance of nails. It's estimated that 75% of people with liver dysfunction develop Terry's nails, where the tips of the nails show a red-pink crescent. Additionally, people with liver disease often develop unexplained bruises on their skin, which can appear in multiple locations simultaneously, unlike bruises from mechanical injuries, which usually occur singly at the site of impact. Interestingly, various liver disorders often present the same symptom around the corners of the eyes, known as xanthelasma. These are cholesterol deposits that accumulate in this area because the liver, as the main organ for cholesterol metabolism, struggles to maintain cholesterol levels when weakened. This results in increased cholesterol levels and deposits in the skin. Finally, remember that during liver diseases, a characteristic purpura can appear on the skin due to a low platelet count, which is, of course, a consequence of poor liver function. Now that we know this, let's move on to another important piece of information. What damages our liver? Many of you might not realize which factor over which we have control is most harmful to our liver. So in brief, first and foremost, obesity damages our liver. This cannot be overstated. Consuming excess calories leads to fat accumulation in the liver. When the liver cannot process and break down fats as it should, they begin to accumulate. This not only damages the liver, but also contributes to the development of type 2 diabetes and increases triglyceride levels, which accelerate the progression of atherosclerosis. Additionally, the liver suffers greatly when we consume sugary juices and drinks. The risk of fatty liver increases by over 60% with these beverages. Other well-known factors include excessive alcohol consumption, smoking, over-the-counter medications, especially painkillers, chronic diseases like diabetes, viral hepatitis, and perhaps a lesser-known factor, extensive body tattoos. A study titled "Tattoo Pigments Are Observed in the Kupfer Cells of the Liver Indicating Blood-Borne Distribution of Tattoo Ink" found black and red tattoo pigment deposits in the liver. This shows that tattoo pigment is transported from the tattooed skin through the bloodstream to this vital detoxification organ. Finally, it's important to know that persistently high cholesterol levels are a significant risk factor for severe liver damage. In a study titled "Dietary Cholesterol Does Not Break Your Heart But Kills Your Liver," it was found that dietary cholesterol can contribute to the progression from mild to potentially fatal fatty liver disease. Dietary cholesterol can be harmful to the liver, especially when combined with polyunsaturated fatty acids, which promote lipid oxidation. Now that we know the symptoms of liver disease and what damages the liver, let's discuss how to help a diseased liver. First, weight loss is crucial. As we know, obesity harms the liver. Here's an interesting fact. If you incorporate cranberries into your weight loss regimen, the rate of fat removal from the liver or its regeneration significantly increases. A study titled "Combined Cranberry Supplementation and Weight Loss Diet in Fatty Liver" found that liver enzymes significantly decreased in both groups by the end of the study, but the reduction was significantly greater in the group that consumed cranberries. It appears that 288 milligrams of cranberry extract can help treat fatty liver, equivalent to 26 grams of dried cranberries. What else can help our liver? Definitely milk thistle. The seeds of this plant contain silymarin, which acts as a shield for the liver, protecting it from damage caused by alcohol, toxins, medications, heavy metals, and other chemicals. A study involving over 2,300 patients with fatty liver disease showed that administering silymarin not only reduced liver damage, but also decreased liver fat. So, how should you use milk thistle? You can consume milk thistle in the form of freshly ground seeds, which can be added to yogurt, oatmeal, or smoothies. It is recommended to consume 2 to 4 teaspoons of milk thistle per day, which provides approximately 300 milligrams of silymarin daily. These are the doses used in scientific studies. Next, let's discuss why those who want to take care of their liver should definitely drink green tea, as it turns out to be one of the liver's best friends. This is a product you should remember from today's episode. Why? Because researchers have observed that people who drink 5 or more cups of green tea a day have a 38% lower risk of developing liver cancer compared to those who do not drink it at all. Coffee also shows a very similar protective effect on the liver. Researchers have estimated that people who drink 2 to 4 cups of coffee a day also have a 40% lower risk of developing hepatocellular carcinoma. Continuing, the active compounds found in garlic exhibit similar properties. Numerous scientific studies indicate the positive impact of garlic supplementation on liver diseases. Interestingly, researchers have noted that consuming garlic powder supplements reduces the risk of fatty liver disease almost threefold. Of course, raw crushed garlic is also beneficial for our health, provided we consume about 1 clove of garlic each day. This habit also lowers the risk of developing liver cancer, just like coffee or green tea. Another incredibly beneficial product for our liver is grapefruit. Grapefruit, thanks to its naringenin content, protects our liver by removing toxins from our body so the liver doesn't have to. Studies involving people with fatty liver disease have shown that supplementing with 200 milligrams of naringenin daily for 4 weeks lowers triglyceride levels, which accelerate the formation of atherosclerotic plaque, hindering blood flow through the vessels. When discussing products that protect the liver, we cannot overlook black seed oil. Just 1 tablespoon of black seed oil daily, approximately 10 to 15 milliliters, has a protective effect on our liver. Additionally, dark grapes and the resveratrol they contain are allies of our liver. Numerous studies have shown that resveratrol reduces inflammation and liver fat by initiating a process called autophagy. What is autophagy? Autophagy is the removal of unnecessary elements from cells. In the case of fatty liver, autophagy helps remove excess fat from liver cells, and resveratrol significantly stimulates this process. Consuming fatty fish or supplementing with omega-3 fish oils also provides great benefits for our liver. Omega-3 fatty acids from fish limit fat accumulation in the liver and reduce inflammation. Taking 1 to 2 grams of omega-3 fish oils daily is excellent support for liver health. Speaking of fats, let's talk about olive oil. Extra virgin, cold-pressed olive oil, like omega-3 fish oils, prevents liver damage and aids in its repair. Regular consumption of at least 30 milliliters of olive oil daily is associated with a lower risk of developing non-alcoholic fatty liver disease, especially in overweight and obese individuals. Now, how can we stay ahead and prevent liver diseases? Dear viewers, tests can help us with this. What tests are best for us? Your doctor will inform you. But I can suggest that liver function can be assessed using the following tests: prothrombin time, bilirubin levels, liver enzyme levels, total protein, and albumin. A particularly valuable test is the measurement of lactate dehydrogenase levels, as this result can inform us about the liver's condition and health or the extent of its damage. Finally, it's worth getting a simple liver ultrasound, which is a reliable test. If it detects fatty liver or early signs of fatty liver, it will first make us aware of the problem, and secondly, allow us to take further steps to improve liver health. Thank you for joining me in this episode on liver health. If you found this information helpful, please give this video a thumbs up and consider subscribing to our channel for more health tips and insights. I'd love to hear your thoughts and any questions you might have, so feel free to leave a comment below. Sharing is caring, so if you know someone who could benefit from this information, please share this video with them. Together, we can spread awareness and help more people take charge of their liver health. See you in the next episode.